Hello, everyone, and welcome to this overview of this poster presentation. This research poster presentation looking at implementing online space for awareness and research, and looking at pediatric and adult nephrology perspectives. And this research presentation, this research poster presentation is a collaboration between an academic institution in the United Kingdom, two social media platforms, and platforms, and an NHS trust in the southwest in the United Kingdom. And this research poster presentation is 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 um, and this research poster presentation is for the UK the UKKW 2024 UKKW 2024. So to begin with, some intro. So chronic kidney disease is a complex long term or long standing condition that occurs in all age groups, despite advances integration uh, despite advances integration between information searching versus knowledge implementation differs for all patients and between healthcare sectors. Therefore, it is important to gain better insight into healthcare service provision for patients. So the aims and objectives around this was the aims and objectives were the where the healthcare where in the healthcare information seeking behavior of CKD patients is important to understand because patients want specific medical and scientific understanding to be able to communicate efficiently with healthcare professionals, and conducting a retrospective pilot descriptive analysis of tag themes or topics between two social media platforms using quantitative data collection methodology. This work looked to investigate and understand how service service healthcare service between online and physical space for healthcare service users and providers can be enhanced. So, in regard to as part of some of the epidemiology. So, about 2 million adults in England have been diagnosed with moderate to severe CKD or chronic kidney disease. Much of the monitoring in these patients occurs in mild to moderate stage of the disease by general practitioners in primary care, with only the final stages of the disease managed in secondary care. Often processes are often inadequate, resulting in miscommunication to patients and healthcare service. Uh, to patients and insufficient healthcare service provision. General practitioners also use criteria agreed in local guidelines to request advice or question the need for hospital clinical the need for hospital clinical review, and primary care records are generally not accessible to secondary care staff. CKD thus can have varied impact on access to healthcare services for both pediatrics and young people and adults. In England, approximately 5 or 6% of the population have CKD stage 3 through 5, and CKD with a higher prevalence in older people and more socially deprived communities. The epidemiology for actual CKD in the United Kingdom relates to what has been outlined by NICE guidelines, or National Institute of Clinical or Care Excellence, or Clinical Care Excellence guidelines, and the KDIGO guidelines. And a stance or a viewpoint has been required to understand and consider trends and how this could constitute improved healthcare services surrounding the CKD population. So now looking at looking at gaps in healthcare services. So CKD is a major public health problem that affects over 30 million in the United States, and it is estimated that 50% of females over 75% over 75 years, and 50% and 50% of males over 85 years have CKD stage 3 through 3 to 5. It has been evidenced that the pediatrics and young people population with CKD is 7 or 8 per million population. So as such, although controversy exists as to whether it is a normal aging process for patients with CKD 3A CKD, it is recommended that age alone should not preclude patients from being managed according to NICE guidelines. Evidence indicates that patients want more understanding of health in a range of areas and want allied health professionals, AHPs, to be part of discussions where they can get more informed healthcare services. This would reduce inequality and improve overall CKD population. Now looking at sort of bettering healthcare services. So it has been over 2 decades since the United Kingdom government published a document, the expert patient, and a new approach to chronic illness, chronic disease management for the 21st century. The intention was that service users would lead others by example, being experts in disease management. The inclusion of expert healthcare service users is little reported in the literature. There has been a push for using Swifter tech to bridge knowledge gaps in healthcare, peer support, and education, but research is required to understand areas of peer support and patient education in context of chronic illnesses. There is also a requirement to evaluate guidelines for patient and public involvement, or PPI, and focus on where commissioning is needing. The number of medical websites written in English is greater than in other languages, and can be advantageous or disadvantageous depending on who is seeking out information and context. However, healthcare service users want understanding of disease and processes. Empowered patients can make informed decisions surrounding treatment choices. So now looking at methodology around this works. So initially topic tags were sort of developed or co-developed for this investigation, where topics between 2 social media platforms were co-developed, having understood the aims and remit of the aims and the remit of the social media platforms. Before topic tags being co-developed, an extensive investigation for at least 1 month, for at least 1 month between March 2020 and April 2020, collated the most popular terminologies. This resulted in 14 different topic tags being developed. 14 different topic tags are being developed or co-developed, and topics were tagged for 2 weeks 2 weeks per social media platform. Uh, topic tagging had been utilized in similar have been utilized in similar works, initially conducting a 16-year retrospective descriptive analysis of topics and tags between two online support groups, look to identify what still needs to be what still need to be met in the care for both pediatric and adults with CKD. Um, in this poster presentation, and viewers and listeners, it might be a little bit small for the screen for you to see on the screen on your screen. However, to annotate some of the some of the context in this table, or table one, looking at summary of the main topics developed or co-developed and tagged between pediatric and adult renal social media platforms. So you have topics developed and co-developed and tagged. So you have lab tests and biomarkers, biopsy and surgery, nutrition, kidney replacement therapy, psychology and related, medication and pharmacy, lifestyle, primary care or GP, wellness and well-being, nursing, exercise or physical activity, educational and interactive, peer support, COVID-19 and infections. In the second column, on the second column, moving on toward on the right, is a list of the number of topics tagged in the pediatric social media platform. So the total of the topics tagged was 1,249. In the third column on the right, on the right is the number of topics tags and the percentage of topics tagged in the pediatric social from the pediatric social media platform, and that is one that the total is 100, as in 100%. And then moving on to the column on the next column onto the right, and looking at the number of topics tagged, the number of topics tagged amongst the adult nephrology social media platform, and you have the number of topics tagged were 1,311, and then in the column on the final column on the left, sorry, on the right, the final column on the right, um, the final column, or the fourth column, looking at the number of topics tagged and the percentage in amongst the adult nephrology social media platform, and that is around 100.14%. So around 100%. So in the in among as part of this as part of the excuse me, as part of the tabulated data, a summary of topics co-developed, tagged, and thread percentage between social media platforms. The table highlights 1,311 topics tagged through the adult nephrology social media platform, and 1,249 topics tagged through the pediatric social media platforms. Topics were tagged again over a 1 month duration between the two social media platforms during March and April 2020. Now, looking at a little bit in around some of the methodology aligned with the ethics, ethics and recruitment. So the investigating team looked to collect quantitative data between two surveys implemented from January 2020 to September 2020. The surveys look to help understand how healthcare services for patients could be enhanced through social media platforms or online spaces. A target sample was implemented to see to a target sample was implemented to seek 100 responses, primarily from CKD patients and allied health professionals or AHPs through the RPSG platform. The research protocol, the research protocol for this investigation is and was where ethics approval was given for this works by an ethics committee based in the northwest side of England in the United Kingdom. And at the same time, patient and public involvement, or PPI, had been an important mechanism. Involving patients, had added focus and rigor. So looking at the GDPR, or General Data Protection Regulation, and in line to this work, since this work looked to collate data from an ethical basis, and utilizing and as part of the process, utilizing GDPR between 2018 and 2020 guidelines had been utilized. So the two social media platforms are international platforms, primarily working through Facebook. Facebook had updated its practice guidelines originally to GDPR 2018 guidance, and where both social media platforms have service users from the United Kingdom, Europe, and internationally, and hence why, according to any services or goods, etc., the UK GDPR or EU GDPR had been applied. The RPSG and KDOS platforms, or the social media platforms, are for healthcare service users suffering with varying forms of CKD. The social media platforms in this context, in context of GDPR, are covered under Facebook's data privacy, under Facebook's data privacy and protection policy. The UK GDPR 2020 prompts consistent data protection rules across the EU, and the EU GDPR and the UK GDPR have been in effect as of around the 25th of May 2018, and applies to organizations based in the EU. As well as companies around the world who provide or offer goods or services, and who process data from or about people in the EU. In keeping with the UK GDPR, the research team had not reported any personal identifiable data, or PID. So, for example, names, dates of birth, addresses, and or locations of participants. The EU GDPR or UK GDPR data protection guidelines were adhered to and applied throughout. So now looking at the analysis and results around the topic tagging, and then subsequently we'll look at sort of the analysis and results in regard to survey data. So analysis and results looking at topic tagging. So between two social media platforms, 2,560 threads were tagged against 14 educational topics over 1 month. Analysis also revealed that patients between both adult and pediatric cohorts still require additional support across several areas of kidney care. Healthcare service through social media or online platforms would be better supported, involving allied health professionals or AHPs, prompting e-clinics online, for example, or in other formats, wherein, for example, focus-based scenarios are utilized to help encourage and enhance shared experiences and knowledge. Excuse me. Now looking at some of the analysis and results in around the survey data. So Qualtrics survey links were made available for around 6 to 8 months, primarily through through the adult nephrology social media platform, the RPSG, and participants only had to complete once a descriptive analysis. Excuse me. A descriptive analysis was used to analyze data, and the data collection followed on from some previous works in around 2020. So 19 surveys were completed by allied health professionals or AHPs, and 45 surveys were completed by CKD patients. The highest responses were from AHPs, the highest responses were from AHPs that were from female backgrounds in around 57% versus males in around 40, almost 43, 43%. And then regarding CKD patients, females in around 55% versus males around almost 39% had wherein there were the highest responses. And the types of AHPs included healthcare scientists around 47%, nephrologists around 17.65%, AHPs around 17.65%, and general practitioners around 5.88%, and patient cohorts included transplant patients around 60.53%, hemodialysis patients around 13.16%, and CKD patients in the CKD stages 3 through 5 in around 10.53%. So now looking at sort of the statistical implications, though participants were invited to complete the survey once only, this did not increase survey response rates. From a descriptive analysis, 30% of surveys were completed by AHPs, and 70% were completed by CKD patients. Conducting a descriptive analysis surrounding the data set was best owing to the set target sample size. And what can be inferred from the data collection process is that online polls work better than that of survey links through social media platforms, because research investigators must also be willing to interact and support online populations. Now looking at sort of the strengths and limitations, one of the main limitations of this investigation relates to limited number of responses from both allied health professionals and and CKD patient cohorts. Respondents from patient cohort had demographics with varying ethnicity, age range, and gender representation. Respondents from both health professional cohorts were predominantly from white backgrounds or Caucasian backgrounds, higher education status, and primarily female backgrounds. The aim should be to equip allied health professionals and patients with knowledge base and to ensure mutual objectives between service users and providers are envisaged between healthcare sectors. So now looking at some conclusions. So the UK government had emphasised the importance of tech in improving healthcare outcomes and offering more patient-centric care. What is still to be investigated is where what is still to be investigated is where healthcare service provision could also include e-health and e-learning modules wherein patients and professionals co-develop online learning through social media platforms. Now looking at the overall summary. So CKD patients have been sharing lived experiences and understanding between two renowned online social media platforms to inform decision making near 3 decades. This international retrospective investigation informs the need for patient and healthcare professional integration to support patients through social media and or online space and between pediatric and adult nephrology cohorts.